this is our masking thing. Anyhow, my lunch is here. Some salad. Some people will be like, what is this masking ADee is talking about? Okay. So masking occurs to most of us, to the best of us. Not everybody experiences it, but it's a thing. And what we're gonna also take away from masking is we also want to be careful with the younger generation, with our nieces, nephews, the younger generation, basically because you don't want to box anybody up. Masking predominantly comes from not only from being neurodivergent, it could also come from how you grew up, the expectations that were put on you. When we've identified that we have masking as a coping mechanism, how do we now unmask? By unmasking, you want to stop doing that, right? You want to be better, because remember, masking can lead to anxiety, depression, panic, inability to function, distraction, forgetfulness, and tons of other symptoms it could lead to. So how do we unmask? By unmasking, we're trying to be just who we are. We're trying to be you. You're just trying to be the best version of yourself without any mask and without seeking anybody's validation. The first measure to unmasking will be identifying what your mask is. Once you identify what your mask, as a matter of fact might be, then we start working on it. You want to identify a safe space to start working on your masks. If you're not safe, if you're mentally not ready, it's going to be difficult to unmask. Remember that even unmasking can also be challenging, because when you start to unmask, you might experience some panic, you might experience sleeplessness, but just keep your eyes on the prize. You're moving towards the right direction. You want to speak to a healthcare provider, you want to speak to a therapist. There are even imagings that can be done in the brain to make sure what you're coping, what actually you're dealing with. As you're masking, you want to also set boundaries. You want to start working on your self-confidence. You want to also treat your anxiety. You want to also treat your depression. If you need to take medications to be able to come out of the funk that you are in, that's totally fine. So work on unmasking, identify it. The purpose of today's coffee table discussion is to identify what our masks are.